Good afternoon,
Hello.
everyone.
Yeah.
Today's session is going to be really helpful and it's led by Dr. Shri Harika. She is going to talk about HPV vaccine, the weapon to reduce HPV infection, which also brings down cancer cervix. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you so much for that. So today we are going to talk about HPV vaccine and HPV virus. So kindly let me know if you have any doubts in the private chat so that I'll get back to you once I finish my presentation. So I'm going to start with the presentation. So today it is all about HPV vaccine. I hope everybody must have heard about cancer cervix and about the HPV virus in HPV vaccine. So why is HPV vaccine so much important and what is HPV vaccine for? So there is a virus called HPV virus, which is called as human papilloma virus, and this virus is mainly responsible for multiple infections and cancers. So this is the HPV virus. What does it do? So there are hundreds of strains of HPV virus. Among them, most of them are harmless, but there are certain strains, like as in 611, are the strains which causes genital warts, that is warts around the vulva, vagina, and even the penile warts in males. And then the rest high risk type of viruses are 16, 18, 13, 33, and all the list of them which I have mentioned here. All of them are responsible for mainly cancers of genital areas of women and men. So, how is this virus transmitted? The mode of infection or mode of transmission of this virus is sexual route. It is a sexually shared infection or sexually transmitted infection. So, what are the risks which can happen with this viruses, with this HPV strains or HPV virus? So, the risks are mainly it can cause cancer cervix, cancer vagina, cancer vulva in women. Both in men and women, it can cause oral cancers and anal cancers, mainly the mucosa. So, these are the organs which contain the mucosa. And in men, it can cause the penile cancers. So now let's talk about cancer cervix and vulval cancer. So most of the women doesn't know or not aware of what is cervix. So, see, cervix is a part of uterus, the opening of the neck of the womb. We can see the uterus over here. The neck of the womb opening down there is called the cervix. And then in the image, we can also see that the pinkish area, which we are seeing on the image, which is present on the left side of the screen, is the vagina. And the brown area, which is seen in the left side of the screen, is the vulva. So these are the genital parts which can get infected with the HPV virus. And these are the organs which can develop the cancer in the women. So now what is the prevalence of this HPV infection? Why are we worried and why should we get vaccinated against this virus? So according to the Centers for Disease Control and Prevention, the CDC, the statistics say that the virus is so common that nearly all sexually active women and men get the virus at some point in their lives. So anybody who is sexually active out there is prone to get the HPV virus, and most of the times the viral infection is asymptomatic. That is, the infection goes without your knowledge. So one can think that once I get the infection, I'll treat it on time. So it is not like that. This is a virus which remains asymptomatic in the genital organs, and in most of the women, it clears up on its own. But in some, it doesn't clear up and it stays long and is responsible for the changes in the mucosa, which eventually will become cancer of the cervix or vagina, vulva, or cancer of the penis. So now, what is the burden of this disease? In India, the Indian women account for 20% of the cancer cervix globally. And according to WHO, that is World Health Organization statistics, we have nearly 1.2 lakh cancer cervix cases annually and 67,000 deaths annually. And in a minute, in our country, roughly about 1 in 8 women die out of cancer cervix. So now what can we do about it? So there are three levels of prevention. One is primary prevention. It is preventing from the infection by giving certain vaccines. The second one is secondary prevention, that is early diagnosis with the help of the pap smear test. And the third is tertiary prevention, that is unfortunately if somebody gets cancer cervix, how do we treat and reduce the suffering of a person? So, in primary prevention, today we are going to talk about vaccination, and the secondary prevention includes pap smear and HPV. Today we are not going to discuss about it. We are going to discuss about only primary prevention. Now, coming to vaccination, the question of the day is who should get vaccinated? So most of the women or most of the people out there have this doubt who should get vaccinated and what are the recommendations. So according to Foxy is a national body. It is Federation of Obstetrics and Gynecology Society of India. The recommendation is that the target age is women or girls between 9 to 14 years of age is the target age. But in our country, in India, the vaccine is licensed up to the age of 45 years. We'll go ahead in the next slides. We'll be able to see why the vaccine is licensed up to 45 years in our country. And as of now, it is only women who are actually, the recommendations say that the women are the people who should get vaccinated. But actually, the vaccine is also beneficial to men. But right now, it is not yet licensed. But there are certain studies which have been going on to bring the license for men as well to get vaccine. Now, the benefit when we see up to 15 years of age, the benefit of the vaccine, studies said that it is highly efficacious. Then, and when you go to women who are more than 15 years or equal to 15 years and more, and who are sexually active, the efficacy is slightly reduced, because if somebody is sexually active, the virus may already must have gone into their genital parts, and then the efficacy will be slightly less. And for the women who are more than 26 years and who are sexually active, again, the efficacy is reduced. And according to recommendations, more than 25 years women should get the screening done with pap smear regularly. And in this age group, whether the vaccine has to be taken or not, it is a shared clinical decision after discussion with a gynecologist. More than 45 years age, the vaccine is not recommended. Now, number of the doses, how many number of doses have to be taken? In girls who are less than 15 years, 2 doses of vaccine has to be taken 6 months apart. 0 is right now, and then the second dose is after 6 months. And in women who are equal to and more than 15 years, it is 3 doses, that is 0, that is right now, and the second dose after 1 month, and the third dose after 6 months. Women who are immunocompromised, when we say immunocompromised, it includes women who are HIV positive, or who are on steroid drugs because of some reasons, or who had history of transplant and are on certain kind of immunocompromised drugs, or any other women who are on this immunocompromised drugs will come into immunocompromised women. And in these women, again, it is 3 doses, that is 0, that is right now, and one second dose after 1 month, and third dose after 6 months. Women who are victims of sexual abuse, it is again as per the age, it has to be either 2 doses or 3 doses, but as soon as possible, the after the abuse, the vaccination has to be started. And interval, when should the second dose be taken? So second dose, if it is only 2 doses, they should be minimum 6 months apart between the first dose and second dose. If somebody forgets to take the vaccine within 6 months, the delay can be up to 12 months to 15 months. Now, there are different types of vaccines. We must have heard, a few of you must have heard about it: bivalent vaccine, quadrivalent vaccine, nonavalent vaccine. What does it mean? Bivalent vaccine means, as the name suggests, it covers two types of strains of HPV, that is HPV 16 and 18. It is available in the brand name Cervarix. Quadrivalent vaccine means quadri, that is, it covers 4 strains of HPV virus, that is virus 16, 11, 6, 11, 16, and 18. It is available in the name Gardasil. And there is also something called nonavalent vaccine. It is available in the name Gardasil. It covers 9 strains of the HPV. So as of now, the recommendation says that the Gardasil vaccine or Cervarix vaccines are recommended. Nonavalent right now, still the recommendations have not come. And the cost of these vaccines, roughly Gardasil vaccine, which is quadrivalent vaccine, which covers 4 strains of HPV, will roughly be around 2,000 to 3,000. Now, contraindication, who are not supposed to take the vaccine: somebody who is ill, severely ill especially, are not supposed to take the vaccine. They have to wait till the illness subsides. And somebody who is allergic to certain drugs or medicines, or who had history of anaphylaxis, that is severe form of allergy, better to see the doctor once and then decide whether they have to go ahead and take the vaccine or not. Because in these situations, we have to check the composition of the vaccine, and we have to see to what component or which component you're allergic, and accordingly the dose has to be prescribed. Coming to pregnancy and lactation, right now pregnancy and lactation, the vaccination is not recommended. And what side effects can happen? See, after vaccination, somebody can have little swelling or pain at the site of injection. Mild body pains, headache, dizziness, tiredness, and all are common side effects, but most of them, they subside on their own. Now, now what is the take home message? So today's talk is all about HPV vaccine. The take home message is that less than 25 years age, the target is 9 to 15, but even up to first sexual intercourse, the vaccine is very much efficacious. So let's together fight against the cancer cervix and female genital tract cancers by doing the primary prevention by prescribing the HPV vaccine to school going students and women who are not yet sexually active. The next important thing is pap smear. Any women out there who is more than 25 years should go ahead and get pap smear test once in every 3 or 5 years, depending upon what test you're going to have. And all of us should aim to see a cancer cervix free India. Thank you. Any doubts? Any questions? Okay, thank you so much.